Hi there, my name is Dr Rubani and I'm a GP partner here at Ling Medical Centre. As you're all aware, our lives have sadly been turned upside down over the last year due to the COVID-19 pandemic. We are grateful to all of our patients for their understanding and cooperation during the changes over this last year. Fortunately, we see light at the end of the tunnel thanks to the amazing work of the scientific community and the COVID-19 vaccination. We've been running these out of Ling Medical Centre and the Skipton COVID Vaccination Hub and have so far managed to hit above our target set for us. And we urge those who are yet to have a vaccine to get themselves booked in and protect themselves and their loved ones from the virus. Although some people may have read things online or heard negative information about the vaccinations, we have all experienced firsthand the impact of the COVID vaccination on our local communities. There have been over 470 million doses of the COVID vaccine given worldwide and 30 million doses in the UK, and they have been shown in worldwide trials to be safe. The vaccines were developed over a year ago and underwent rigorous worldwide trials before being green-lit for patient use. We are already seeing the positive impact in reducing the number of COVID-19 cases and the admissions related to this. The few patients who may go on to develop COVID-19 have also been shown to have much milder symptoms. The virus came very quickly and caused many of us lots of distress and confusion. Unfortunately, due to this, many people have posted misinformation online. It is often easier to create simple but incorrect answers in these challenging times. However, we have seen the negative implications that this misinformation can have on our local communities, in particular the BAME population. We wish to reassure our patients that there is no truth in this misinformation, and it is clearly only going to worsen the negative impact that the virus has had on our most vulnerable communities and patients. Coronavirus has had the world's attention and all of the world's greatest scientific minds working on it at the same time. Further to that, the vaccines were originally created around a year ago and have undergone a full 3-phase trial, which means they've been tested on over 44,000 patients before they were greenlit. The COVID-19 vaccine is a small piece of spike protein which helps to train your body to fight any future COVID-19 infections. It cannot make you test positive for coronavirus. However, it takes about 2 weeks for your body to build up immunity. If you're exposed to COVID-19 before the immunity builds up or before the vaccination, you can go on to develop COVID-19 and test positive. The most common side effects that people tend to mention are a bit of an achy arm. Some people can feel a bit achy generally or a slight fever. In most people, these are very short-lived and usually last a day or so. This is essentially your body training itself to fight the COVID-19 infection. And as we can gather, it's much more preferable to developing a full-fledged COVID-19 infection. You may have heard initially some of the reports of cases of allergic reactions in some health workers. These were in people who suffer with anaphylactic or very severe allergic reactions, which can cause swelling of the lips, tongue and shortness of breath, and these people will usually know they have these reactions because they carry adrenaline or EpiPens with them. The guidance has changed slightly since the vaccines have come out. If you have had multiple anaphylactic reactions or an unknown anaphylactic reaction, then you should have the Oxford AstraZeneca vaccine. If, however, you only have mild to moderate allergies, you can have either vaccine. We know from evidence that if you have had a COVID-19 infection, your body will have some antibodies, but we do know that these are not long-lasting and you can go on to develop coronavirus again. However, the evidence has shown that through the COVID vaccination, the antibodies last a longer period of time and are at a higher level. This therefore means that your protection will be longer term. As long as you have 4 weeks post-infection, you should have the COVID vaccination. The vaccine cannot alter your DNA. The DNA resides within the nucleus of the cell. The Pfizer vaccine, which is a mRNA vaccine, as the name suggests, contains RNA. This lives in a different part of the cell, and so the two do not interact. There is no evidence at all linking coronavirus, the vaccine, and fertility. We know so far there have been millions of people who have been infected with coronavirus, and there has been no impact on fertility shown from this. In the UK, we are using both the Pfizer and the AstraZeneca vaccine. Neither of these contain any pork or gelatin in them. They have both also been approved by the Muslim Council of Britain. So far, in 17 million people vaccinated with the AstraZeneca vaccine, only 14 have developed blood clots. There was some fear around this. However, studies done by the European Medicine Agency and recent US trials have both shown its safety and no link at all with blood clots. Even after the COVID vaccination, we know that some people can still go on to develop coronavirus, although as mentioned before, the symptoms are much milder. We can also therefore still pass this on to other people who are vulnerable or who have not had the vaccine. It is therefore very important that until further data and evidence has been collected and more people have had the coronavirus vaccine, that we continue to follow social distancing guidance. All viruses can mutate, and so far some variants of the COVID-19 virus have also been found. Just like the flu virus, we have a yearly vaccine that is given, and this covers the most dangerous or most prevalent forms of the flu. The COVID-19 vaccine also covers the more dangerous versions and covers most of the new variants also. Rather than focusing on new variants, it is more important that we continue to push with getting people vaccinated, reducing the number of people developing COVID-19, and therefore reducing the number of new variants and complications which can arise. So as we see, the vaccine is tried, tested, effective and safe. We all see a way out of this pandemic, and it involves us all working together to get ourselves vaccinated, to protect ourselves and our loved ones from this virus. We urge you all to please contact the surgery when your turn arrives and to get yourself booked in for the COVID vaccinations. I look forward to seeing you all in the future and returning to a more normal way of living.